A disc is made up of two different parts. The outer portion, which is what we call the annulus fibrosus, and the center portion, which we call the nucleus pulposus. If I zoom closer here, that outer layer is made up of all these small little fibers that connect together, and their job is to connect the two bones to each other, and then to also contain that nucleus in the center. There are lots of different ways that discs can be injured, whether it's just normal day-to-day activities over time, lifting heavy things, repetitive bending, motor vehicle accidents, contact sports, slip and fall, you name it. There's a bunch of different ways that these can be injured. But there's a couple different terms that we use to describe the severity of the injury. Okay, so I'm going to go through a couple of different of those. The first one is what we call a slip disc. And I start with this one because it's not really a term we use anymore. So we're trying to dispel the myths here. So there is no such thing as a disc that just slips out of position. They are so closely woven and tied into these bones that just doesn't happen. Most medical providers don't use that term anymore. What does happen though, if I show you this, is you can see that some of those fibers are missing or damaged. This is what we would call an annular tear or destruction of the annular fibers. If that is severe enough, then we get to the next level, which is a disc bulge or herniation. Now it's important to know that if I were to take a random 35 or older person off the street and I did an MRI, odds are there's going to be one or two bulges or herniations, but they may have zero symptoms. So it really just depends on where is the bulge, how big is it. It will cause problems down the road as it degenerates because obviously a tissue that's damaged is going to get damaged further. But what happens with a bulge or a herniation is that there is enough damage to fibers that disc material in the center actually either pushes outward or it escapes containment altogether. And that's what we would actually call a prolapse or a sequestration. And then you have that disc material either free floating in the spinal canal or directly on nerve tissue. Anytime we have a disc injury, the most important things to look out for are numbness, tingling, progressive muscle weakness, or any type of loss of bowel, bladder control. Anything that seems really, really weird neurologically could be from that disc putting pressure directly on nerve root or directly on spinal cord, okay? They can be managed and treated conservatively. So if you can, you want to try and avoid surgery, injections, or medications. Here we use chiropractic care, rehab, and our non-surgical decompression table that actually pulls whatever material is bulging back towards the center, rehydrates the center of the disc, and actually strengthens those annular fibers. So that's a little bit about discs, some of the injuries and issues that happen with them, and how we treat it here.